I'm Sally Herndon from North Carolina, which you probably know is the leading tobacco-producing state in the nation. And in just a few minutes, I'm going to give you a quick 20-year story, a story about changing social norms and policy. When I first started doing tobacco control full-time, I fought very hard to be the manager of Project Assist, the American Stop Smoking Intervention Study, which was funded by the National Cancer Institute. It's a good story about spread and scale where we learned a lot of the things that Brian talks about what works. 17 states were funded. My mother was dying from emphysema, and this is what I felt like I was meant to do. In Project Assist, we had a 2-year planning phase, and we were not allowed to go into intervention phase until we finished the deliverables of our 2-year planning phase. And there was knowledge about that in the world. And just before the intervention phase was to launch, a bill was passed that required state-controlled buildings in North Carolina to set aside 20% of their space for smoking, as was practicable, and to not allow any local government to pass anything stricter. So we've had many talks today about how you learn from your mistakes or your setbacks, and that was a huge setback for us as we were just about to launch this major initiative. So we really had to go back to ground zero. We had to go back to the community. We had to start thinking about what are we going to do that will really work. You all know that there's more and more evidence still coming out every day, including with this year's Surgeon General's report, that secondhand smoke is a major serious threat to health. It causes heart attacks. It now is considered a risk factor for stroke, and everybody knows that it causes cancer. It's also a very serious risk factor for asthma, and we have some really good colleagues who have asthma who knew that before anybody knew it. So schools is what we went back to. We started going back to just the grassroots, and we started looking at schools in North Carolina, school systems that had gone 100% tobacco-free. And we collected their stories, and we said, what school districts do you all influence and which ones influence you? And everybody could tell us. So we had breakfast with those school districts, and we started having school districts that had gone 100% tobacco-free to tell their story. And we started spreading. And about that time, we did get Master Settlement Agreement funding. That was our fat cow period that was talked about. We had MSA dollars, and we had money to put into communities with boots on the ground. So we managed the 100% tobacco-free schools campaign like a very well-orchestrated campaign. And we had a pediatrician who was a senator who said, when you get to 85%, I'll introduce a bill. And we said, do that, but introduce a bill that doesn't just make all school districts 100% tobacco-free. Introduce a bill that requires that school district to adopt 100% tobacco-free school policy, because you have to go back to the community level and get that built in and support. And then there was a positive thing that happened as a result of that. There was a very progressive hospital administrator in one of our communities, and he said, you know, our schools are going 100% tobacco-free, but we're the beacons of health in our community. We need to go 100% tobacco-free. So our hospitals started the same movement, and they started tracking the same kind of trend. And then Duke Endowment and the North Carolina Hospital Association said this is something we ought to be accelerating. So they put money in to accelerate the spread of 100% tobacco-free hospitals. But the mental health hospitals were left off the map. It took us 3 years for the mental health hospitals and the substance abuse facilities in North Carolina. But as of last July 1, we have changed the norm in mental health and substance abuse hospitals, and they've gone 100% tobacco-free. We also had the strategy to take, our government buildings were not smoke-free or tobacco-free. We had the strategy of taking the General Assembly building tobacco-free and then arguing that if it was good enough for the legislators, that it ought to be good enough for state employees. The healthcare cost forced an opportunistic move to get our prisons to be 100% tobacco-free. It was a surprise to me, but I had great time running around North Carolina prisons doing clean indoor air testing in North Carolina prisons and helping take those facilities tobacco-free. So it's taken us 20 years to overcome this, but in 2010, we accomplished what is our biggest accomplishment because it's really leading to more additional change, and that is we became the first of the southern states and the only tobacco-producing state to make our restaurants and bars 100% smoke-free. We've evaluated the data. It's improved our air quality by 89%. We have a very strong complaint-based system of compliance, which is very strong because the consumers who use these facilities and the employees and their staff all will turn in a complaint. They come to our computers on Sunday night at 6 o'clock and we turn them into the local health director to follow through at 8 o'clock the next morning every week. We evaluated the first year. We had some resources to evaluate the first year, and we saw a 21% weekly decline in emergency department visits from heart attacks. We saw a 7% decline in emergency department visits from asthma in that year that the smoke-free restaurant and bars law went into effect. We've continued with help from Pfizer and the CDC Foundation, continued to track that we've had no negative economic impact in terms of no lost jobs and no lost receipts for restaurants and bars. Our Restaurant and Lodging Association was our most important partner in this process. We wanted no exemptions. They wanted a level playing field for business sake. Those are two things that go hand in glove. So we've had a fair amount of success. The amount of approval for our smoke-free restaurant and bars law in North Carolina has increased over every year that it's been implemented. January will be our 5-year anniversary, and we're planning a big 5th year. We've had to defend the law in the General Assembly every year. We've also had to defend the part of the law that actually repealed part of the preemption. But we've got an 83% approval rating from voters, and it doesn't matter which stripe you wear. It's very strong no matter what kind of voter you are. Our future progress is going to be to take advantage of the other part of the law that I haven't talked about yet, which was to at least partially restore the local authority to ban smoking in government buildings, government grounds, and public places. And I say partially because public places was defined, this was the best we could do, and why we're not on the chart for smoke-free workplaces, is defined as any indoor space where the public is invited inside. So most workplaces have customers at some time or another, so most of the places are covered under this authority. But there are some workplaces that are considered private, and we haven't tested it out in the courts yet. We've had a huge response to local government authority being restored. It's been threatened in the General Assembly, but there was bipartisan support to keep it and let it remain the same. So our future opportunities are continue to work at the local level to help build support for smoke-free government buildings, government grounds, public places, community colleges. We've got 35 of the 58 community colleges are 100% tobacco-free. I think I shared this morning that North Carolina is poised to become the second state in the nation to require smoke-free properties to receive tax credits for opening smoke-free, and we're very excited about that, and I'd be happy to write up a little something for this roundtable group on that when it becomes official in January. And then finally, we're wanting to take the work that we've done with mental health hospitals at the state level and substance abuse facilities at the state level and take that into the community level so that our community-based resources that are working with mentally ill and substance abusers can work on tobacco addiction at the same time that they're working on these other addictive behaviors. So that's our work for this next coming year. Thanks so much.